So welcome to this new episode of Brain and Spine Surgery. I am Dr. Jaydev Panchwak. Today I want to speak about what is spondylosis. Now this question is asked multiple times in our brain and spine OPD, and I intend to make a short film about it today. So what is spondylosis? So this word comes from two words actually. The first word is spondylos, which means vertebra, that is the vertebral body of the spine, and osis means disease or inflammation. So in simple words, it means disease of the spine. And spondylosis is so common because it happens in almost everybody. After the age of 30 years, the vertebral degeneration starts. And if you take X-rays or MRIs of 50 people who are not symptomatic, you will see evidence of spondylosis in them. So first thing that we have to remember is that spondylosis is not a disease. But if the process of spondylosis increases beyond a limit, which happens in few people, then it can cause pain and compression on the nerves and spinal cord, and then it becomes a disease. So spondylosis, as I said, is nothing but inflammation or aging of the spine. In simple words, it is aging of the spine. It's like our hair become gray as we age. So spine also becomes gray. This is what is spondylosis. So when does it become pathological? That's what I want to tell you. And to understand that, first we have to understand what is a spinal unit. So a concept of spinal unit. So our spine is made up of multiple vertebrae which are stacked one over the other with intervertebral discs in between. So if you take two vertebrae which are adjacent to one another and a disc in between, this forms one spinal unit. So the spine is made up of multiple such units. Now, to understand the process of spondylosis, let us focus on one spinal unit. Now, as we age, what happens? What is the first step in the spondylotic process? What happens exactly? The disc or intervertebral disc is made up of two elements. The first element is the outer tough element, that is annulus fibrosus, and a central soft jelly-like element which contains a lot of water in it. It is called as nucleus pulposus. As we age, the water content in the nucleus pulposus goes on reducing. This causes reduction in the height of the disc, which means the two vertebral bodies slowly start approaching one another. The gap between the two vertebral bodies starts reducing, and then the body starts realizing that there is some malalignment happening in the vertebral column. So I was telling you about spinal unit, and here it is. You can see one vertebral body, the other vertebral body, and the disc in between. This is a rubber model, and you can very clearly see the disc which is cushioning these two vertebral bodies. Behind the vertebral body is this portion which is called as a pedicle, and in between these two vertebral bodies there is a foramen or a hole, let's say in a simple word, through which a nerve is coming out. There is another nerve which will come out from the opposite sides. So at each level there will be a pair of nerves. Now if you come still behind, you will see that these two vertebrae are having a joint between them. This is called as a facet joint, and these are the spinous processes which we can actually feel from behind with our finger. Now, as I was telling you, the spondylotic process starts with reduction in the height of the disc. So this vertebral body starts coming near to this vertebral body, and the alignment of this joint also starts getting imbalanced. So the body starts realizing that there is some new problem occurring in the spinal column. So what is body's normal reaction to any imbalance or instability that it senses? For example, whenever there is a fracture, body sends more and more calcium to heal the fracture. So when body starts sensing this instability, it starts sending more and more calcium to this area, and that's how a lot of calcium deposition starts. Body tries actually to fuse these two vertebrae to one another to stop the abnormal movement, and these are called as the osteophyte or beak-like processes of calcium. Now, if these beak-like processes are deposited inside the spinal canal, now obviously there are nerves inside, so the nerves, spinal cords will start getting compressed because of these beaks. And so in people in whom this spondylotic process crosses a line, they start getting the symptoms of the nerve compression or spinal cord compression, and then it becomes really a disease or a pathological problem. In initial stages, people will get pain in the local region, then people may get pain which radiates along the nerve. As you can see in this picture, I have drawn few osteophytes, that is new calcium deposition here. The disc height is reduced as compared to this disc height, and this calcium layer is also extending inside the spinal canal, pressing on the nerve, and these people can get what is called as radiculopathy, that is pain which radiates along the nerve in the cervical region, in the arm and forearm to the fingers, and in the lower limb, buttock, thigh, calf and the foot. So these are the radiculopathies, either lumbar radiculopathy or cervical radiculopathy. If the spinal cord is compressed, then it's a more serious matter, because spinal cord is nothing but a cable which relays impulses from the brain to the body and from body to the brain. So it's a cable, electrical cable like structure. If it is getting compressed by a similar osteophyte similar to this which is pressing inside, then there will be problem with the spinal cord function. These people with cervical myelopathy have difficulty in performing intricate movements with their fingers. They are unable to walk without losing balance, and eventually they become bedridden. So these are the sequelae of severe spondylotic processes. Concluding the whole issue, spondylosis is nothing but aging process of the spine. Almost everybody will have it to some degree. If it crosses the line, then it becomes a disease, and then problems start either with radiculopathy or myelopathy. So we have to remember that if these symptoms start appearing, then one has to take early note of it, diagnose it early, so that further sequelae could be averted. If you want to watch more videos about spine problems or brain problems, please subscribe to this channel. Thank you for watching this video. Until next time, goodbye.